This is Brian from MedigaplList.com. Today I'm going to talk about Medicare for All. Is it good or bad? The basics is it's very puzzling to me how both political sides argue about Medicare for All, whether it's good, bad, or indifferent. My opinion is that both of these sides just want to come up with a system and take credit for it. I don't think either one of them really knows what they're doing because I don't think government knows how to run a business, period. If you look at the post office and different things, they usually have to sub out their businesses to private companies to get them to work. That's how Medicare works. They have their Medicare system, which is the largest budget expense every year for the past so many years. And then they sub out Medicare supplements or Medicare Advantage plans and Part D, which is the drug plans, to private companies because they can't handle it. They don't know what they're doing. They have to watch over it, but they can't run it. That's why if you look at the Part D plans, every one of them is private insurance companies that are handing out the drugs, and Medicare sets the standards, but they don't know what they're doing. So how do we fix this? Medicare for all, good or bad? Yes or no? Well, basically, I see this as a point that goes back all the way to 1971 and Richard Nixon telling John Connally to take us off the gold standard. And people say, well, what the heck are you talking about? It's 2018. You're going back to 1971? I say yes, because you have to understand how our country thinks, especially Bernie Sanders and this girl, Ocasio-Cortez. They don't, I don't know about Bernie Sanders, but definitely Ocasio-Cortez. Being so young, being from New York, growing up in this era, she really thinks we have an open checkbook in this country. She's very passionate about Medicare for all. I see why she's passionate about it. She's not incorrect for being passionate about it. She wants to help people get insured, and that's a good thing. The problem is the Republicans are arguing on the other side that globally, we're on a dollar standard right now, which means, China and all these places are basically forced to buy our bonds so that we can print money. They're buying our debt. If that ends, all of this stuff is meaningless because we won't have any money to support it. So look into that before you start looking into all the different, programs that our country gives out. Because, like I said, right now we have an open checkbook. It's not going to last forever, in my opinion, especially with the problems going on with oil and everything. And that's where the general public doesn't understand. They think we have an open checkbook. We can do whatever we want. We're the richest nation in the world, which is true right now, but it's teetering off. So let's just get into Medicare for all and skip all of that. Please do your research about the gold standard in 1971 and why and how and what and so forth, why we had to go off of the gold standard and basically go on to the bond standard, meaning we print money, we issue bonds for people to buy that money, buy our debt, and we pay for our social programs with that debt. But if the world stops buying our debt, we're finished. So basically, let's forget about all that. Let's focus on 2018 and 2020 and pretend that we actually have a government that runs our country fiscally conscious, which they don't. All right, so the Democrats want to cover everyone for health care for Medicare for all, with Medicare for all. Sounds fantastic. I'm in Medicare. It's actually a great system. They say it's going to be insolvent in 2030, which is only 12 years away. But it's a great system as it is now. People are happy. They're not paying that much money. And the insurance is great. So if we did that for everybody, where would the money come from? The Republicans worry that it will be a tax on the working man and the people who don't work, who sit around and smoke cigarettes and do drugs and watch Jerry Springer will get great health care and they don't deserve it. I agree with both sides. We need to get health care to people who deserve it, and we need to be fiscally conservative and not just let people trash their bodies and get sick and then get health care and get whatever they want. So we can come from a compromise because I think everybody realizes both of those sides. I was not a fan of Obamacare. It was a tax on small business, and it was a tax on people that made over $50,000 a year. That's a fact. I was on Obamacare. But he went through some hard times trying to pass something for health care, so I understand, how that all went down. But we can come up with a system that probably can help everyone. The system that I would put in place. Now, this is just very broad. I'm not going to get into details. But I think we should have private insurance companies servicing people for health care. Now, if the government wants to watch over it like they do with Medicare, that's fine. But it has to be private insurance companies because they run businesses better than the government can. Just like 10 years ago, but 10 years ago, if somebody was sick, they couldn't get underwriting, which means they couldn't get an insurance plan, which is not good. We have to have every citizen on some kind of health care plan. So they either have to extend the Medicaid for people that are sick but actually have money, because Medicaid is for low-income people, or we have to come up with a new system. Now, this is what I would do. I would have a tax system where people have to pay into a fund, everybody. It comes out of their paycheck, whether it's $10 a week or, we have 300 million people here, 160 million that are working or so forth. Where a small tax that would go into a fund that would pay for sick people. It doesn't have to be a huge tax. I know people don't like hearing that, but if we want people, especially, people that are doing what they're supposed to be doing, they get a disease, they can't figure it out, they should be covered. They shouldn't have to suffer. So in order to get this insurance, though, you must follow the following guidelines. You must go to a physician or a facility once a month and get your blood checked, your cholesterol, and all these type of things. Have someone watch over you. Are you eating garbage, drinking beer and liquor all day? Or are you doing what you're supposed to do? If you're doing what you're supposed to do, you stay in the program. If you're doing, same thing, get your blood checked once a month for tobacco and illegal drug use. If you're smoking cigarettes, you don't get free insurance. Plain and simple. I hate to tell you this, but you can't just do what you want and then expect people to give you something for free. It doesn't work that way. It has to be very strict and stringent. If possible, the recipients need to be checked if they have employment, or if they're able to work, at least help them get a job. You can't sit on your rear end and get free insurance. You don't have to have a great job, but just something. And if you can't have something, maybe they come up with something where you have to volunteer, at some kind of hospital or something. Nursing home, help the sick, help the old, whatever it may be. If you can. If you're sick, you can't work, so it is what it is. Now, my system wouldn't include children. Children need to be taken care of, and that's it. Plain and simple. They get health insurance if they don't have it. So let me know what you think. Comment below. And if you want me to get into detail, I'll do another video that gets into detail of what this program would have to have.